You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. One of our listeners recently sent in a question. His name is Aaron Franco, and he's the administrator of the Phoenix Center. This is one of the premier skilled nursing facilities in Pennsylvania. You can learn more about their services by visiting www.phoenixcenterhc.com. Aaron had a great question about blood clots. Let's take a listen.
Hey, Dr. Emron. My name is Aaron Franco, and I run a 138-bed skilled nursing facility in Phoenixville, Pennsylvania. I had a question regarding the preference of using a CAT scan versus using the VQ test to detect a pulmonary embolism during pregnancy. My understanding is that the VQ test has less of a radiation exposure than that of the CAT scan. However, I am concerned about the accumulation of radiation in the bowel, which sits next to the uterus. My first question is, what tests would you recommend to detect a PE during pregnancy, the VQ test, or by using the traditional CAT scan? A follow-up question would be is that in the event where a PE would be detected during pregnancy, what's your preferred medication? Would you rather use heparin or Lovenox?
First, let me thank Aaron for taking the time to record a very detailed question about a problem that affects many pregnant women globally. There are different names for a blood clot depending on which part of the body is affected. If a blood clot is in a vein and it's in the leg or the arm, we call it a venous thrombosis. If it's in one of the deep veins, it's called a DVT, which is a deep vein thrombosis. If the blood clot starts in one place and it travels to another, the medical term is embolism. So again, a thrombosis is a type of blood clot, but if that thrombosis goes from one part of the body, such as the leg, up towards the other part of the body, that's now called an embolism. PE stands for pulmonary embolism. Pulmonary means lung, and embolism means blood clot. The blood clot probably started in the leg and then traveled through the veins, went through the heart, and was pumped into one of the arteries that goes to the lungs. Whenever that blood clot is stuck in a certain location, that's called a PE, or a pulmonary embolism. Blood clots can develop anytime there's a disruption in the normal blood circulation, or if there are external factors that cause the blood to become thicker than usual. The medical term for that is called a hypercoagulable state. Now, coagulation is the process where the body wants to create a blood clot. For example, if you cut your finger with a knife while you're cooking, you'll have some bleeding for a few minutes. Platelets will form, and there's chemicals that are released, which cause coagulation. So in that situation, it's a good thing. You want a blood clot to form. Without the coagulation pathway, a simple cut would actually become life-threatening because people would just continue to bleed and they would become dizzy and have anemia. Now, there are some situations that are hypercoagulable. Those are abnormal. For example, if someone just had a major surgery, such as a hernia repair or appendicitis, that person is at a very high risk of developing all types of blood clots. First, those people are less mobile after surgery. Most people don't want to walk or exercise because it hurts too much, and they have stitches that are swollen, still healing, and they're very raw. So a lot of people just lie in bed, or they take it easy for a week or two or a month, and that actually causes the blood to become thicker. Thickened blood has more coagulation factors, and that will cause a higher risk of developing a blood clot abnormally. Now, if a person has a broken ankle or a broken arm, they usually have to wear a cast. And typically it's going to be 6 or 7 or even 8 weeks. The part of the body that's enclosed in the cast is going to have less range of motion, and there's also going to be a breakdown in the muscles and some of the soft tissue. This also affects the blood circulation, and it makes the blood thicker, and again, more likely to have a blood clot. So there are many people who've had surgery or who've had a broken bone, and a few weeks later, they develop a blood clot, and those are the reasons why. Now, there's some people who are not in the medical field or not in the hospital or have not had any injuries, and they can still develop a blood clot. So those people would be at a high risk if they're traveling. And that's true if you're traveling on a very long car ride. For example, if you're going from New York to Colorado. It can also happen if you're flying, such as from Los Angeles to Miami. And international travel has the highest risk of developing blood clots. Many of those airline flights are getting longer and longer. For example, you can travel from Houston to Dubai, and that's a 16-hour nonstop flight. So for 16 hours, whoever is on that flight is going to be sitting in one position. They might get up to go to the bathroom, or they might get up to stretch their legs, but you're physically up in the air for 16 hours. The blood circulation is directly affected because of that. And now most airlines are actually required to show you videos about stretches and exercises you can do while you're on the plane to reduce your risk of developing a blood clot. Now, there are some people who can actually develop blood clots simply because of a family history or a genetic defect. And then there's other people who get blood clots because of a history of cancer. So common things like colon cancer or leukemia cause a direct effect on the coagulation cascade, and that can result in spontaneous blood clots. So again, there's several different sources of blood clots. It depends on the person's age, their medical history, whether they're in the hospital, what other medical issues they have. Now, the one that we're going to talk about today is pregnancy. So when we talk about pregnancy, really it's a unique state of health. We know that women who are pregnant are going to have dramatic changes in their hormones. And hormone changes actually allow the baby to receive proper vitamins, nutrients, and development through the placenta. So hormone changes are necessary. However, some hormones will increase the risk of blood clots. And that's why people who take testosterone or estrogen or even birth control, which are all types of hormones, can actually develop a life-threatening PE or a pulmonary embolism. Now, in pregnancy, when we talk about gestational age, we have to be as specific as possible. So doctors, when they examine a woman who's pregnant, they're not going to say she's 6 months pregnant or she's 8 months pregnant. Rather, they're going to describe it in terms of weeks. So if someone is 12 weeks or less, that's considered the first trimester. If someone is between 12 and about 24 weeks, that's going to be the second trimester. And then if someone is 25 weeks onward, all the way up to 40 weeks, 41 weeks, 42 weeks, those are all third trimester. Now, in the first trimester, the baby's brain and the nervous system are actively being developed. Whenever there's a problem in the first trimester, bad things are going to happen. If there's an infection in the mother, if there's a side effect from a medication, if there's a trauma, that's all going to cause a high risk of miscarriage because the developing baby doesn't have much reserve, and that's when the brain and the chromosomes and the organ development is all very, very active. Now, in the second and third trimester, the baby continues to grow, but now they're less susceptible to side effects, and many medications that are no longer used safely in first trimesters can be safely used in the second or third trimester. The risk is never zero, but it decreases as the child becomes older and stronger. During pregnancy, we do know that the mother also gains weight and becomes less mobile. It's a lot easier for a woman to walk around when she's 10 weeks pregnant compared to when she's 35 weeks pregnant. Women also retain fluid, especially in their legs. They become very swollen, and they have trouble sleeping in certain positions. So oftentimes they sit around in a recliner or they try to find a position that's comfortable for them. And all those things will increase the risk of blood clots. Now, based on statistics, we do know that 1 out of 1,600 pregnancies will have some type of a blood clot. PE is the number 6 cause of death in pregnant women in the U.S. And about 9% of all deaths in women who are pregnant are directly due to blood clots. We also know that there's a racial disparity. So African American women have a 4 times higher risk of dying compared to white women just because of the pregnancy and if they have a blood clot. So if a woman is African American and they have a DVT or a PE, there's a 4 times higher risk that she's actually going to die because of complications. And we don't know if that's genetic, family history, or something else, but there's definitely a concern with that. So now that we're thinking about blood clots, how do we diagnose it?
Hi, I'm Eric.
And I'm Aisla.
And together we are the hosts of the Bicarian podcast. Let's tell the lovely people what we do.
That's a great idea. Bicarian is our answer to the polarizing nature of our society today.
We usually have on very compelling guests that are experts in their fields, and we like to do our own deep dives into a lot of interesting subject matter.
And discover what's underneath the rhetoric and reactions that show up kind of everywhere.
We also cover a lot of topics, everything from politics to current events to geek culture. We find a lot of different compelling things to talk about on our shows.
If you're like us and want to explore multiple ways of looking at things, we hope you'll join us.
So please check us out on Bicarian.com for current and past shows.
And come and be part of the conversation by following us on your favorite social media platform.
So in the ER, where I work and where many other doctors work, we train our nurses and staff to look for certain specific signs of respiratory depression or respiratory distress. So if a blood clot is in the lungs, we expect those people are going to have shortness of breath, chest pain, trouble speaking in full sentences. They're going to have a very high pulse rate, and they may even have a drop in their blood pressure. Those people are not circulating blood normally, and the body is not able to compensate. So those people are going to look very, very sick. If the DVT is in the arm or the leg, there'll be swelling just in that extremity. So an ultrasound can be done very quickly to look at the blood flow. If the blood flow is blocked, that means there's a blood clot sitting in that area. Now again, a thrombosis occurs in the legs or the arm. If it breaks off and it travels, that's an embolism. If it goes to the brain, it's called a stroke. If it goes to the heart, that's a type of a heart attack. And if it ends up in the lung, that's a pulmonary embolism, also called a PE. Now, if the blood clot is in the lungs, the ultrasound won't help us. It's not going to show us what we need to know. And a chest x-ray also is not going to help us. So we have to use one of two tests that would be available depending on the facility. One option is called a VQ scan. So a VQ scan is a ventilation perfusion scan. This is the preferred test during pregnancy. It looks at the blood flow and the air circulation in different areas of the lungs. Wherever there's a mismatch, that tells us there's a blood clot. The other test is called a CT scan. It's also called a CTA, or a CT pulmonary angiogram. In this situation, contrast dye is injected into a vein, and the CT scanner is then turned on. As the contrast circulates through the body, especially the lungs and the arteries, the CT scan creates a map. Any place where the contrast doesn't go is a blockage. That means if there's a blood clot sitting in a certain location, nothing can circulate downstream from there. And this could be in one lung or it could be in both lungs. The smaller arteries are going to be the highest risk of developing a blood clot because it's really based on size. For example, if the embolism is about 5 millimeters, it's going to go through all the vessels that are 10 millimeters, 8 millimeters, even 6 millimeters. But as soon as that blood clot hits a blood vessel that's less than 4 millimeters, it's going to be stuck. So everything that occurs after that 4 millimeter area is going to be affected. It's going to lose blood supply, and that includes muscles, organs, and tissues. Now, CT scans use contrast. So we talked about injecting the contrast to see where it goes. The way that we measure it is because it's radioactive. Now, if a woman is pregnant, we don't want radioactive material near her baby. We do know that radioactive issues damage chromosomes, and they also damage DNA. So a CT scan, just one CT scan, has the same amount of radiation as 150 chest x-rays. So that gives you an idea. If you've had 150 chest x-rays in your life, or if you've had one CT scan, the amount of radiation you've had is the same. Now the contrast, once you inject it and it circulates throughout the body, it has to be filtered out, especially by the kidneys. So this means not only is the contrast toxic to the baby, it could also be toxic to the mother and her kidneys. So that's why we prefer the VQ scan as opposed to the CT scan. The problem, though, is that not all ERs are going to have a VQ scan. So there may be like small towns or certain areas where the only option is a CT scan. And if we don't diagnose the blood clot, it will be life-threatening. So that's why some places will still use the CT scan, but we prefer the VQ scan whenever possible. So again, that's the first part of Aaron's question. So the VQ scan is the preferable option. Now the second part of Aaron's question is even more important. So once we've identified that there's a blood clot or a PE, what is the treatment, especially in a pregnant woman? So let's first talk about men and women who are not pregnant. So in men or non-pregnant women, we oftentimes use a medication called warfarin, also called Coumadin. And there's other medications that are related to that, which are newer ones called Xarelto and Eliquis. The problem is you can't use any of these oral medications during pregnancy. They are toxic to the baby, or there's not enough data. So we can't use any of these oral options in a pregnant woman.